We're going to be diving into a story about the Lampard Inquiry and what is the mental health public inquiry and what it could change. And we're also going to read into this exclusive of bereaved parents who feel betrayed as the UK's largest ever mental health inquiry begins. Let's go, you guys. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with a triple piece of stories here for you guys. We're going to be discussing the Lampard Inquiry, and I'm going to break down for you guys a bit about what this inquiry is about and how it, as someone who has suffered from mental health, and how it affects me. The first piece we're going to read into is what is the mental health public inquiry and what it could change. We're also going to read into this exclusive from iNews about the bereaved parents betrayed as the UK's largest ever mental health inquiry. And I'm going to share a little bit about the Lampard Inquiry itself on the website itself. I'm also going to provide a link here for its YouTube channel so that as the inquiry continues, if you guys want to follow along with it closely, you can do. I will put the links for all these things in the description. Guys, while you're here, make sure you hit the like button and share it across social media so others are notified of this video. So as I've said, mental health is something that has affected me, and it has affected my ability to work. It has affected many people's lives, and it can really be detrimental to them. Now, for those who don't know the stories, obviously lives have been lost as a result of fundamental failings by the NHS. And I think rather than me try to break it down for you the best way, I think this piece from the BBC that I've read, I think if we read it together, it gives you guys a better understanding of this, guys. So what is the mental health public inquiry and what could it change? So mental health patients are among the most vulnerable in society, but services in England have been under huge strain for at least a decade, with sometimes fatal consequences. And a public inquiry backed by the government will focus on deaths in Essex as a starting point. Well, what is it and what does it hope to achieve? So solicitors representing a growing number of families who have lost loved ones said the Lampard Inquiry, which starts on the 9th of September, so it would have started by the time you guys see this, is as important as those around the post office and the infected blood scandal. The deaths of up to 2,000 people could be included in it. Essex has seen repeated failures over 20 years. And what has happened in the country could be an indication of what is going on elsewhere. By examining those failures in detail, there could be implementations for mental health care across the NHS. Now, I do want to stress, obviously, before as we continue to read into this, this is something that the Labour government, before it came into power, was something that there was something that within the NHS that they did want to tackle. They have talked a lot about wanting to deal with mental health, and they understand the issues. They have talked a lot about the issues around it and the understanding of it. Something that we do not hear, almost never hear from the Conservatives. So I do think that's really, really important. I also want to stress that I'm still suffering from my throat infection, so I do apologise if you get any grunting or whatever. I am still trying to recover from that, so I do apologise. So what is the aim of this inquiry? So the Lampard Inquiry is the first public inquiry specifically looking into mental health deaths. It is its aim to understand what happens to patients who die at children and adult inpatient units under the care of the NHS in Essex between the years 2000 and 2023. So we're talking about a big gap there. The inquiry will focus on Essex Partnership University Foundation NHS Trust, the EPUT, and the North East London Foundation Trust, the NELFT, along with organisations that existed previously. It will not look at deaths in the community unless they have happened within 3 months of discharge from a mental health unit, the patient has been assessed or refused a bed, or they were waiting for a list for a bed. Public inquiries are funded by the government and led by an independent chairperson. They can force witnesses to give evidence, although that will not apply to families. No one is found guilty or innocent, but the inquiry published recommendations. The government can accept or ignore them. So that was just for a reference of what is an inquiry. It is named after the chairwoman of the inquiry, Baroness Kate Lampard. She's the former barrister who oversaw the NHS investigations abuse into the former television presenter Jimmy Savile. You'll remember that. Baroness Lampard is a member of the House of Lords, as she is a crossbench peer, meaning she's not affiliated to a party as well. She has said she wanted to make recommendations on how to improve the provisions of mental health in patient care. So what is the focus of Essex, guys? So the calls for an inquiry were first made by the mothers of two 20-year-old men who died at the Lincoln Centre and Mental Health Unit in Chelmsford. In 2008, Ben Morris, the son of Lisa Morris, was found dead after calling her to say that he wanted to leave. 4 years later, in 2012, staff said they found Manish Levy's son, Matthew, unresponsive, and he was pronounced dead at the hospital. He'd reportedly been raped days before he died. Staff did not follow the trust policy after the allegations, and his care plan was falsified. Since then, repeated failures have been raised in the country. Right here is one of the biggest things, is when staff are not following the policy there. The health watchdog, the Care Quality Commission, have raised concerns around the safety of wards and staffing from 2014 to 2018. Recommendations were not acted on. And in 2017, Essex Police launched a corporate manslaughter investigation into the deaths of 25 patients at 9 mental health units, but there were no charges. Police said that some cases did not meet the evidential threshold. And in 2019, the Parliamentary and the Health Service Ombudsman published a report into the deaths of Matthew Lethry and Ben Morris. It quoted, "and systematic failure to tackle repeated and critical failures over an unacceptable period of time." And a year later, Melody Libby and 24 other families set up an online petition for an independent inquiry. About 105,000 people signed it, forcing a debate in Parliament. And in 2021, the former Health Minister Nadine Dorries said a robust independent inquiry would be held, but it would not have full legal powers to compel staff witnesses to give evidence. And that same year, the Health and Safety Executive fined EPUT at $1.5 million after the deaths of 11 patients. The judge said there had been a litera of failures and suicides had not been prevented. There was a story I covered, I think it was last year, about the crisis in the NHS mental health care. I don't know if that was directly linked to it, but directly linked to the inquiry, but it would not surprise me whatsoever. Last year, following another cover report by Channel 4's Dispatch, CQC rated 2 female wards inadequate, and it showed staff sleeping while they were supposed to be observing patients. In the same year, the inquiry was given full legal powers at the request of the former chairwoman, Dr. Geraldine Strafedy, who stepped down for personal reasons. More deaths were then concluded for investigating because of ongoing concerns over service. All these lives, could they have been prevented, guys? So what are the concerns being investigated? So I like the COVID inquiry will be split into different themes, including physical and sexual safety in the medical health inpatient units, including possible allegations of abuse. The chairwoman says she will use legal powers to ensure the evidence is produced, protecting the identity of staff and referring matters to the police if needed. Patient assessments under the Mental Health Act, the level of community support, whether wards are safe, fit for purpose and health recovery, how patients with different needs like autism and learning disabilities and those with drink and drug issues are dealt with, the use of technology like CCTV with centres and the impact that it's had on patients' privacy and dignity. I think that's a good one. That's a very important one there. How medication is managed and balanced with therapeutic care. How patients escape from inpatient secure mental health wards and what happens after. The circumstances in which patients are restrained, including the use of sedation and chemical restraint. Whether concerns have been raised by staff, communication with family, staffing, training and use of temporarily or agency staff, and whether there is a connection between poor care and the use of non-permanent staff, culture, management and governance, and how Essex compares to other places. Pre-Singwar from Holes, Jones and Allen, which represents 126 families, said the deaths of patients in psychiatric institutions cannot continue in the UK. This is an enormous opportunity for mental health care in England, and I'm hoping we can find out what's been going so badly wrong. The current chief executive of EPUT, Paul Scott, said his thoughts were those who had lost loved ones, and we will continue to do all we can to support Baroness Lampard and her team to provide the answers that patients, families and carers are seeking, he said. However, Mr. Scott has disputed the 2,000 death figures made public by the inquiry. He said he included deaths from natural causes where, for instance, people have been transferred to hospitals after having a heart attack. NELFT, which provides child and abscondence and mental health services in parts of Essex, said we will continue to work with the inquiry to help families understand the circumstances surrounding the loss of their loved ones. Patient safety is an absolute priority, and we're committed to learning from the work of the inquiry. The inquiry will hear opening statements from Chair Baroness Lampard from the 9th of September, which, by the way, that'll be out. From the 16th of September, bereaved families will read impact statements. This will continue during sessions in November. And in 2025, the first evidence sessions take place with barristers questioning the trust and other participants on their experiences. And the hearings will take place at the Civic Centre in Chelmsford and will be streamed on YouTube. Like I said, I will have the link for that channel in the description for you guys. 10 organisations and 56 relatives, patients and staff will initially give evidence in person, although more may be called to participate as the inquiry progresses. The inquiry wants anyone who has relevant information or documents to contact them. The date for the final report is unknown. It could be a few years. So this here, guys, I'm just going to take you to the website here. So this is the let me just adjust it here. This is the Lampard Inquiry, guys. If you just type in Lampard Inquiry, I'll put a link in the description if you want to know, but I just wanted to share this bit here, the Lampard Inquiry here, the bit of background on the inquiry. What they have here on this website, guys, it will have a lot of the documents, hearings, updates and whatnot. So even if you didn't want to watch the whole proceedings, which is totally understandable, if you wanted to have a look in a bit more, this is the place to come to, the Lampard Inquiry. I'm sure that there's not much here because it hasn't officially started yet, but over time, obviously, more information will come as the inquiry continues. So if you want to look at that, obviously, a link for this will be in the description. But I just wanted to read this bit background onto the inquiry from the website. So the Lampard Inquiry is a statutory inquiry investigating mental health in patient deaths in Essex. It's chaired by Baroness Kate CBE. The Lampard Inquiry continues to work with the Essex Mental Health Independent Inquiry, and on the 27th of October 2023, the Department of Health and Social Care issued a formal notice of convention confirming the inquiry's statutory status. You can read more about that here. Between the 1st of November 2023 and the 28th of November 2023, Baroness Lampard held a public consultation on the inquiry's team of reference. The final team of reference were published on the 10th of April 2024. And like I said, there'll be lots of information here from the Lampard Inquiry, which you can see as well here. So I just wanted to give you guys all that context and background before I take you to this piece here, which is exclusive from the Eye, which is obviously linked to it. So the bereaved families were portrayed as the UK's largest ever mental health inquiry begins. The investigation into deaths of up to 2,000 people who are being treated at a mental health trust in England begins today, but some parents have been excluded. So this is the exclusive is basically stating that many parents have not been included in this. Now we've had similar stories. Similar kind of stories when the COVID inquiry, where certain people have not been allowed to express themselves within the COVID inquiry, for example. So there's definitely there. So now I don't know enough. Sorry, I don't know enough about the about this inquiry to speak on it. So this is why I think it was really important to highlight about the inquiry itself, with the pieces that I wanted to share before I read this exclusive with you guys. So it's entirely possible that there may be perfectly justifiable reasons why why some parents may have been excluded, because obviously not every single person who is a part of this inquiry or has been deeply affected by this can participate in it. The Baroness and judges, they can't include every single person as much as everybody wants to. That's why there's normally a representative that speaks on behalf of those people. Hence why they had that with the COVID as well. But also, if some people's voices are not being able to pass on to those who represent them, and those representatives are not getting to speak at the inquiry, then it's perfectly understandable for them to feel aggrieved and upset about it, especially something that is pretty much permanently scarred those people in their lives when they have lost loved ones as a result of the mental health that they have suffered and not been getting the treatment and the care that they have needed. Considered a great act of betrayal by the National Healthcare Service that is supposed to be looking after them, and the places that they have been watched over by the staff who were supposed to look after them. And I think that's a really, really important context. So let's read into this story, guys. So Dozens of families who lost loved ones while under the care of the NHS said they feel abandoned and betrayed on the eve of the UK's biggest ever inquiry into mental health service. So an investigation into the death of up to 2,000 people who were being treated at a mental health trust in Essex between 2000 and 2023, who died within 3 months of being discharged, will begin on Monday. As I said, be out. However, some parents have been left angry after being told their children's deaths will not form part of the inquiry despite being cared for during the period in question. Kamar Bankwa, 68, and his wife Hardy fought for years to get help for their son. Darian, who suffered from a number of conditions including autism spectrum disorder, depressive disorder with psychotic symptoms and learning disability. He was an inpatient under the care of the Essex Partnership University NHS Foundation Trust, the EPUT, between February and June 2020 and was sectioned under the Mental Health Act. Darian was later downgraded to informal patient status, meaning he was to be nursed on general observation with open leave, despite having expressed the intention to kill himself. He was discharged from the Lincoln Centre in Chelmsford on the 7th of July 2020 against his parents' wishes. Darren was assessed at home by NHS staff on October the 9th and 13th of November that year. But despite his parents' concerns over their son's very worrying behaviour, he was not admitted as an inpatient again. Darren, the youngest of 5 brothers, took his own life on December the 27th, 2020 at the age of 22. So clearly, just this story, and there will be more, this person was going to kill themselves. The warning signs were there. Parents warned them, and despite all the assessments, they still thought that the person was fine. This young person was fine, and they still let them out. They knew that there were concerns, but they didn't think there was enough for them to warrant keeping that person in. And that person is no longer with us. That is without a doubt a failure. Now, I will obviously caveat before I keep going, guys, back. It is very hard to read people sometimes. Some people are much better at others, but we can't always be 100% certain about some people's questions and motives and what people say. We don't always know for sure. But that's not an excuse whatsoever for the NHS for not being able to see this. And I think that if anyone who knows their children better than anybody, it is the parents. And if the parents say, please don't let this person out, please don't let our son or daughter out, they should really take heed to that and just letting them out. Now, I don't think it was because, I personally do not believe this was because of a capacity issue. However, I could be wrong. We do know the NHS was struggling. That may have been one of the reasons why they let them go early. And they thought that there was not enough evidence to suffice, perhaps, that person would commit suicide. But that person is no longer here now. And what happened to him didn't need to happen. His parents, Colbad and Heidi, applied for the core participant status, meaning they would have rights to be able to suggest lines of questioning via the council, but were turned down by the inquiry chair, Baroness Lampard. Mr. Baswasi told I told the Baroness she needs to meet me to discuss my son's complex case, but we were ignored. She's a barrister who knows how to navigate the system. She was on the Jimmy Savile inquiry. We feel she has ambushed us because we were only told things at the last minute, along with others simply did not have time to respond adequately before the inquiry starts. So they're claiming that they wanted to speak at the inquiry and they were told no. Darren received a home visit from a consultant psychiatrist on September the 18th, 2020, who decided that he did not satisfy the criteria for detention as an inpatient. The inquiry told the Bank Wales that although Darren had previously been an inpatient, he had been discharged 5 months before he died, meaning his death would not fall with the scope of the inquiry. It doesn't feel right to me. Okay, yes, you can argue. Some people could argue that 5 months is a long time, but still, things can change in a whim. I'm not happy with that. The inquest into her death concluded that Darren's discharge should have been managed in a more professional way among multiple failings. The court heard he was advised by senior medical practitioners to self-treat at home with little to no professional guidance as to what his treatment would involve. Mr. Baswana said, "We were trying to get Darren admitted all the time, but they just wanted to get rid of him completely. I have a letter from the hospital apologising, saying his release from hospital was unsafe and that his care in the community was substandard. So we were so devastated to be told we didn't warrant call participant status, angry, upset." I'm going to read that bit at the end, guys. The first inquiry into the mental health was set up in January 2021. Yeah, we've read all this bit. Yeah, they're just telling us about... Yeah, we've read all that in the previous one. So, why are we being means tested over legal funding? So, bereaved families here out are being asked for their financial status before giving their impact statements. So, inquiry chairs are obliged to ascertain how many assets are being and how much monthly disposable income core participants have before deciding whether a payment towards their legal representative should be awarded in the public interest under the terms of the Inquiries Act 2005. Inquiry core participants have been asked if they have disposable income of less than $3,200 each month and whether they have assessed assets of exceeding $60,000. Julia Carter, whose son Chris Noah died 2021 under the care of the Essex Partnership University NHS Foundation Trust, told the Eye, "Some people said that they have been asked this, but this is strange. They shoot you and they want you to pay for the bullet. But what if we do not have the minimum assets and needed to pay for legal aid, but then choose not to or could not? We could have an inquiry with no lawyers on one side. It's just nonsense. Our lawyers have been funded as late as physically possible so that they're on the back foot, and possible deadlines were given over witness statements. It didn't have to be this way." Melody Lecker has fought for a public inquiry for more than a decade following the death of her son Matthew, aged 20, at the Lincoln Center in 2012. She said, "Why are we being means tested? Who made this a policy and why are we being penalised? The communications have been poor. We have been asked by the inquiry through our solicitors who we're bringing with us, but we don't even know what day of the weeks were coming and what time. So how can we possibly do that when we don't even know when we're being called? Some people have loved ones at home that need to find care for, others in working need to take time off. We all have distant lacks of confidence in how it is being run already before it even starts." Prita Singwar, partners of Holden Jonas and Allen's, represented more than 120 victims and families, and said, "Our families are being asked about their incomes and savings to see if they are eligible for the legal costs to be covered by the government. Families are stunned as they are in a position that they have to provide this information. In their eyes, why did the minister not dispense of means testing? Did the chair propose dispensing means testing to the minister? If not, why not? Why are the families being put in very stressful situations if they are told if their relevant criteria are not met? That they may have to cover legal costs for an inquiry which is looking at their families by the state which has resulted in the deaths of their loved ones." Spokesperson for the inquiry said costs relating to legal representatives are a matter for the government. However, health officials said while ministers determine the parameters for legal costs to be awarded by statutory inquiries, individual decisions about legal costs and core participants are made by the inquiry chair, independent of government. The inquiry will sit for 3 days from Monday and hear opening statements from the chair, lawyers representing families of Essex Partnership. Yeah, they will hear impact. Yeah, we've been told all this already, but this bit already, but it says there at the end, "We remain committed to assisting the inquiry and work with partners to transform mental health care as we fix into our NHS." Yeah. Health Street. Yeah, this is from West Street. And yeah, thoughts with all those affected, including family, loved ones who tragically died. Yeah. So no doubt, West Streeting, the health secretary, will definitely be looking into this, you guys. So I know this was a longer video than what I normally do, guys, but I really do think I wanted to get as much info to you guys as possible, because I do think this is really, really important. As someone who, obviously, I am nowhere near on the level of what these people are going through, of what those who are going through through the NHS, or whether it's private or whatever mental health help that they are getting. But this inquiry is without a doubt very, very important, very serious, and needs to be given the attention and care. But clearly there are questions already being raised about the way it's being run, the way it's being handled, and some of the decisions that are being made. like I said, I will have the links in the description for all these things, guys, if you want to have a look. But without a doubt, there are definitely, it's not just the inquiry itself and what they find out, but I think the way it's been managed does not look very good on paper. But perhaps we don't always have the full information in front of us. But this is what I have for you guys with regards to the Lampard Inquiry. But I wanted to get your feedback, guys. What do you honestly think about the Lampard Inquiry? For those of you who may have been on this case a lot more than I have, please feel free to leave more feedback on this than maybe you guys know a lot more than I do. What do you guys make of the story about some parents being excluded for it? Let me know your thoughts and more about all of this down in the comment section below. If you found this video informative, please hit the like button. We greatly appreciate it. Please share this across social media so others are notified of this video, and subscribe if you can, because it really does help support the channel. If you want to go one step further and financially support me in the work that I do on this channel, you can do so by becoming a YouTube member for as little as 99p, or you can even join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.